All right, our next speaker, Dr. Jason Williams, another brilliant man. I'm not going to list all of his credentials. He is, however, an interventional radiologist, which is always amazing to me. Using amazing imaging techniques, he is able to insert immunotherapies into tumors to help the fight against cancer. More interestingly than that, however, he was a professional football player starting at the age of 38. It's a very interesting story, and hopefully he will tell you about that as well. He owns a banana farm in South America. Kind of random factoids, right? Anyway, please bring to the stage, or welcome to the stage, Dr. Jason Williams.
Thank you. Thank you. I appreciate all of you being here. You know, we're all here for the same reason. We're all dying, and we have to do something about that. You know, one of the things, of course, is a big problem is cancer. And I'm here to talk a lot about, early detection, prevention. These are things that are important. Obviously for me, my work is mainly in treatment of cancer, a little bit different. So trying to actually cut down my business, but that's a good thing. So, there's a lot with cancer prevention, but the thing is that if we cannot cure cancer, then we'll never achieve radical life extension. If you live long enough, you will get cancer. And I know, a lot of patients or a lot of people say, well, I eat healthy, I exercise, I do all the things that should be right for cancer. That's what most of my patients are that way. They're healthy people that, they don't smoke, they, vegetarians, other things. You think they shouldn't have gotten cancer too. And cancer happens when, cells are dividing, the DNA is copied. Sometimes there's mistakes, sometimes there's viruses that cause a mistake. The cell then goes rogue, and it tries to grow on its own. And if the cancer was doing something useful, it would be an organ. Cancer is part of your own body, and it convinces your body that it's supposed to be there. And it uses that to have basically your body help it. It's part of your own body. The body sees it as an organ. It's going to try to take care of it. It's going to try to protect it. And that's what makes cancer very hard to treat. I find myself here particularly because the more work I do in cancer, I keep accidentally running into things for aging. Years back, my main focus was in genetic engineering, along with, of course, being a radiologist. And I was doing some work looking at cancer wasting, muscles in cancer, and looked at a gene called follistatin. And I did some work with animals, but one of the things is that I don't like to kill the animals. I like to keep them. So I had all the animals and I treated them, and then I kept them as pets. And I kept the set that I treated, and I kept the set that I didn't treat as the controls. And the ones we treated, they were muscular, they were very furry, they basically seemed very young and energetic. And I watched as it went on. And then all the ones that hadn't been treated started dying, and the ones that were treated were still living, and were still going on, and they looked very young. I thought, this is really interesting. So I was looking to try to prevent some of the wasting aspects, but also it seemed to be something for longevity. And I think the thing is that, we need to cure cancer for sure, because if you live long enough, you will get cancer. And it's kind of like saying, well, we want to go to Mars, but you should go to the moon first before you go to Mars. Now, arguably, is curing cancer more difficult than curing aging? I think it actually may be. But I think the understandings that we are getting from cancer treatment will help us with fixing aging. So, it's really important that we have complete control and treatment of cancer. Our current treatments, cutting off body parts, giving chemotherapies, radiation, that's not what people want. I mean, these people are left with lifelong scars they're always going to have a reminder of their cancer. They're not going to be the same. You know, a person wants to be treated, they want to get over it, and they want to be the same as they were before. And that's what we're trying to achieve. How can we treat somebody and leave them intact? And so that's the work that I do, obviously, where we go and we stick needles into tumors and we convince the immune system to attack it, and that's the direction that we're going. Obviously, I know Ray was mentioning earlier about dostarlimab, very, interesting on those studies. That's certainly the direction that things are going. Unfortunately, that only works in a very small minority of patients with certain genetic aspects of their tumor. Though we have found ways to manipulate that and make more patients like that. So I think that we'll see more and more. Clearly, the immune treatment, immunotherapy, is where things are going for cancer. Of course, one of the things is in how do you keep from getting cancer? Well, it's challenging. A lot of people say, well, supplements, curcumin, green tea extract, antioxidants, all these things, sure, may be beneficial, definitely. There's, a lot of mixed results, and I don't really want to get into the areas that are controversial. I mean, it's hard to know for sure. We'll discuss some of the aspects. The one that's kind of interesting, comes up a lot, is selenium. So selenium being basically, an element, a micronutrient. And, you look back, and the thing that I started doing when I wrote my book was I looked and saw how selenium could be used to actually treat cancer, how patients on immunotherapy, when they were failing, if they were given selenium, that they started responding. But the interesting thing I noticed that there was one real difference. It wasn't the same selenium that you buy. So you look at like this study here, where they say, well, people who have higher selenium levels had lower incidence of cancer. But then notice what it says down at the bottom. It says, however, we didn't find a protective efficacy of selenium supplementation. So people with higher selenium levels, but not actually people taking selenium supplements, had lower incidence of cancer. So then you look at this form of selenium, methylsalinic acid. So all the studies that were done indicated that methylsalinic acid was the selenium that helped reduce cancer incidence. American Cancer Society did a big study starting in the late 70s, concluded in the early 90s that patients who were given methylsalinic acid had a 50% reduction in breast cancer. It's huge. If we could reduce 50%, probably other cancers as well. But why is methylsalinic acid not in the supplements? I look, check all the different ones. I try to find it. Nobody has that. Maybe somebody can tell me. I really don't know why, but it seems like our source of selenium is wrong, and still something that hasn't been fixed because you can't really get it. But something to be aware of course, having selenium, mainly making sure you're not deficient in selenium is probably hugely important. So that's one thing to consider. The other, vitamin D. Well, there's lots of people with low vitamin D levels. Vitamin D, we know that if patients are low in vitamin D, their cancer treatments are not as effective, their immune response is not as good. These are things that seem simple, but I just bring them out because a lot of people are not aware. And so, this is something, again, we're looking at what type of things can you do that are simple that can reduce your risk of getting cancer. And so, vitamin D supplementation certainly is right there on the list. Now, the big thing, we talk about now the increased incidence of cancer. I can remember when I was younger, they say 1 in 8. Now they're starting to say maybe 1 in 3. Now they're saying that people between 40 to 59, the incidence of cancer has increased 79% in the last few years. So what are the reasons for this? One thing we look at is the gut microbiome, the bacteria in your intestines, and how those bacteria interact with your cells, your immune system. They work together. The bacteria are metabolizing food, and they're producing substances which then interact with your immune system and are telling your immune system to do things. Can make your immune system stronger, or make it weaker, depending on who you've got in there with the bacteria. And certainly, one of the things is a diverse microbiome. Having lots of different types of bacteria is hugely important. But, in modern times, we've been insulting our microbiome. Certainly antibiotics, and I'm not saying antibiotics obviously are beneficial when you need them, but there's many other things, preservatives, artificial sweeteners, sucralose. I mean, sucralose looks like an antibiotic structurally, functions like it, kills, lots of bacteria, reduces your diversity of microbiome. I have patients in, of course, they say, well, I don't use sucralose, I use stevia. Stevia, I know it's natural, also kills your bacteria. Not good as well. So yeah, I know it's a shocker. Nobody believes that. You think things are natural. Natural stuff will kill you too. So just because it's natural doesn't mean that it's safe. And so these are all important things to know, but the microbiome is, I think, essential. And I think if you look at particularly, in my practice, I have a lot of pancreatic cancer. And previously, my patients with pancreatic cancer were usually always over the age of 55. Currently, the majority of my patients are between the age of 30 and 45. Now, that's shocking. And so, obviously this impact on the microbiome builds and builds. These people are now more prone. And so, what do you do about it? It's not just taking probiotics. Unfortunately, that doesn't fix it. When you look at your microbiome as a rainforest, taking probiotics is like planting corn. You're planting one or two bacteria, and the patient says, well, but no, it has 400 billion. Yeah, 400 billion of the same bacteria, not 400 billion types of bacteria. It's not enough. You can't really take the probiotics, and sure, there's lots of fermented foods and all those other things that are helpful, but it's not enough. And there are certain key bacteria, and as we understand more and more, we know certain bacteria that you need to have that will help boost the immune response. But certainly, I think, one of the things we really have to look at is the microbiome, and looking at, patients or people with lower fiber intake, they have less diverse microbiome. So, people with more plant-based diet tend to have more diverse microbiome. Of course, then what do you look at? Of course, like pesticides, other things like that, glyphosates, those are like antibiotics. They kill your bacteria. So some of your vegans are also not benefiting either. So these are all things to consider. We know there's certain things that you can take, like camu, which comes from the Amazon rainforest, looks like a little cherry. You can buy it. It actually gives nutrients to your microbiome, because it's one thing having a diverse microbiome. The other thing is, what do you feed it? Because for it to do what it needs to do, it needs to get the proper nutrition. And so certainly, very, very important to consider. And clearly, the number one thing is trying to reduce your incidence of cancer. And if you can't just reduce obviously you can do the best at that, but then what about early detection? So early detection, I think, the area where a lot of interest is in this genomic testing, but looking at tumor DNA in the blood. This is kind of like a crime scene. Crime scene, they're looking for DNA in the crime. So the crime is a tumor. You know that they have certain mutations that might be common in various cancers. And so you look in the blood for that DNA being shed into the blood, and that would give you an idea that there may be a cancer present. Certainly this is a way to detect things earlier, maybe before they're even visible. But clearly a direction we're going. Grail gallery testing is one of the ones. There's several others that are coming along, but they're looking, at this tumor DNA in the blood. I think this is clearly, and this is a test that's available. You can actually get it now, and that's going to ultimately replace a lot of our other screening, colonoscopies. Not yet. Don't throw those out yet. But clearly in the future, that's going to be the way that it'll be. Now, of course, there's a lot of talk, I think particularly since, Kim Kardashian got the pre-nuvo MRI. Everybody's talking about the MRI screening. MRI, this technique is not, it's not really new. I've been a radiologist for over 20-something years. We've had it my whole career. It's just now getting to the public where there's what's called diffusion MRI. The nice thing about it, it's an MRI, so MRI doesn't use radiation. It uses magnets and radio waves. So you have a big magnet that when the electrons are spinning around the nucleus of the atom, particularly looking at hydrogen, the magnet lines them all up so they spin, and you send a radio signal into it. It knocks the electron, and the electron flips and pops back the signal that you send into it. And that's how it determines what you're imaging. And what it looks at when you're looking at water, on this you're looking at the movement of water. This is what we call diffusion of water. And so you don't have to use contrast, you don't have to use radiation, and you look at how the water's moving in the cells. Cancer is very densely packed. The water doesn't move as freely as it does in other cells, so it has what we call diffusion restriction, and that shows up on the MRI. It's a good way to detect it, but again, you're not going to see anything that doesn't probably have several million cells, so it's early, but still not that early. And by that point, the cancer is already forming its little network, so it's going to be still harder to treat, but certainly better than some situations. But this, is another tool that you're hearing a lot about, and they're both great. I think you really have to use them all, in conjunction. Now, where are we going with things? Of course, a lot of our work is with, sticking needles into tumors, destroying them with energy, freezing them, using pulsed electrical fields, causing the immune system to see the tumor, attack it, inject immunotherapy into it to cause the immune system to attack it. Of course, now, we're able to go and take a biopsy, give it to the pathologist. He'll tell us it's cancer or not. We can then zap the tumor, inject it with immunotherapy, treat it all at the same time. And so then you can have a patient comes in and you say, okay, we did your procedure, you had cancer, we treated it, and now you're good. And that happens. This is a case patient with pancreatic cancer. You can see the needle sticking into the liver. You can see here a scan showing this big tumor in the liver. Then in the middle, there's tumor in the pancreas. And then this is after treatment. This is actually about 10 months later. So you see a PET scan, you don't see any activity there. You don't see any activity there. This patient now has a complete response. And then using the same technology that I discussed where we measure tumor DNA in the blood, you can see has the patient's results here where they had the measurement of the DNA in the blood, goes down to 0. That means that there's no detectable. Now, it doesn't absolutely mean the patient doesn't have cancer. It could be a level that's below detectable and he still has cancer. But if your number is not 0, you have cancer. So, this is really important in showing the results. So then, of course, as I mentioned, understanding cancer will allow us to know more about anti-aging. So here's a case. A patient has tumor in the liver, has chronic hepatitis B. He has cirrhosis. The liver, you can see, is shrunken, has fluid around it. The calcifications are from some of the treatments he's had. That's all big tumor mass all around the calcifications. We went in, we stuck a needle in there, we did a pulse electrical field, we did a cryoablation, and then we injected immunotherapy into the tumor. Then you can see this is a scan about 4 months later. And I'm going to show you how I'm going to prove that this is the same patient. Notice the difference. His liver is big, is normal. It's not shrunken, it's not cirrhotic, it's not nodular. The patient was actually cirrhotic in liver insufficiency, having ascites, having to have fluid drained, and then now, look, his liver regenerated. The reason is that some of the immunotherapy that we used blocks certain signals that now allows regeneration of tissue. And it doesn't only work in the liver, It works in other areas of the body. We've already seen it and done it. You can inject this into the muscles. You can make the muscles young again, and the muscles will then begin producing young substances, which will help the rest of your body stay young. And this is where some things are going. Obviously, there's a lot of exciting work in anti-aging right now, but this is the work that we're seeing. You can see how this patient, you can see it's still the same guy. You see the calcifications up in the top part of the liver. So just showing you that's the same patient. This is a PET scan showing he doesn't have any abnormal activity where he had the big tumor, showing that his cancer is now treated. So again, recapping everything, if you live long enough, you're going to get cancer. That's what happens. So for us to achieve real longevity, we need to cure cancer. That is basic. Prevention obviously is best, trying to keep from getting cancer. If you can't prevent it, then early detection. That's second best. And then third best is that you treat it with minimally invasive techniques, sticking needles into tumors, causing the immune system to see it, causing the immune system to attack it, getting long-term responses, getting cures, but leaving the patients intact, leaving the patients as good as they were before cancer, and that's where we're going with things. That's what we're doing now with patients. And as we learn more and more on treating cancer and understanding cancer, we are going to know more about anti-aging, and we're going to help people live longer in addition to just treating cancer. And I appreciate your attention. Thank you.